I am a medical anthropologist. We study health from a cultural perspective, and that's what brought me here to Nevada. I'm very interested in rural health. During atomic testing period, people were very patriotic. That was the 50s and the 60s, and people seemed to understand that there might be a need for testing. But then over time, as health problems started to arise, then the communities started to not be so homogeneous in thinking about the testing, especially families that started having health problems, children with leukemia, for example. And then when they identified that the leukemia could possibly be due to the atomic testing, then the community started getting conflict in it. There's a sense of anger as well. They were patriotic, and then they feel the government says they could have compensation. They've gone for compensation, but it's been very, very difficult to get it. And they tell me they can't trust the government. They thought they would have done the right thing in the testing, and they didn't. They don't feel now that they did do the right thing toward them. And now there's fear that they're not going to do the right thing by them if something should ever go wrong with Yucca Mountain. Because what the problem with atomic testing was we had really poor health data for comparison. So when families said they had health problems, we didn't know whether those health problems had been there before or not. So that was part of the problems of getting compensation, was proof of causation. Okay? And so it was decided, well, can we get some baseline health data in place should Yucca Mountain go forward? And then if something should happen, we know what the baseline was before Yucca Mountain became operational. In summary, I would say that in Nevada, it is very difficult to separate what happened from what might be the potential effects of Yucca Mountain. We have been exposed to radiation in the past, and with the potential of being exposed from radiation from Yucca Mountain, it would be impossible to separate the two exposures. And I argued to the Department of Energy, we've carried the nuclear load before, now they're asking us to carry it again. That makes this project much more complex for us than it might be if it was placed elsewhere, because we already have effects.